Good morning. At age 9, with my friends, we used to braid friendship bracelets. We would sit at my kitchen table after school and on the weekends with a beautiful bag of string of all colors and sit together and braid friendship bracelets. At the time, it was a simple hobby. It was something that brought us together. But this hobby became something bigger when we began to sell these friendship bracelets to raise money for cancer research. We got together as a team for our local Relay for Life chapter of the American Cancer Society and called ourselves Braiding Bracelets. We would sell these bracelets and donate all of our proceeds. I didn't realize it at the time, but every bracelet represented compassion and hope. It was leading me towards a lifelong purpose that I wasn't even aware of at the time. In that way, I began to learn my first lesson about health, as I was doing something to help someone with a disease that I barely knew anything about. As I learned about cancer incidence rates and how cancer affects different people, I realized that health is personal, communal, and it's a team effort that affects everyone and their families unequally. As a college student in New York City, I would walk to class, passing world-renowned hospitals alongside people who couldn't afford basic care or a doctor's appointment. This realization left me with a great foundation for research, to get involved to figure out how I can bridge these gaps. And I'm proud to say that my first research project began right in this building in my advanced science research class as a high school student. My first study was titled Project ScanVan, Mobile Mammography Services to Decrease Socioeconomic Barriers and Racial Disparities Among Medically Underserved Women in New York City. We analyzed the data of a mobile mammography van, and a mobile mammography van is exactly what it sounds like. It's a van equipped with the latest technology to provide life-saving screening to women who need it. This van, most importantly, provides these screenings free of cost. Anyone can show up not speaking English, without health insurance, and receive the care that they need. We studied the data of over 2,400 women who were served by this van. We realized that the van was successful in overcoming traditional barriers that women may face when seeking out breast cancer screening. The van also followed women and provided follow-up care as needed. As a high school student, I realized this seems to have the potential to bring care to more communities. I wondered how many people don't know about a mobile mammography van, as I didn't know about it prior to this research. So I took this data and I created an organization that organizes breast cancer screening services, free or low cost, around the 5 boroughs of New York City. You can log on to my website, click the borough you live in, say the Brooklyn or the Bronx, for example, and you can see all of the free or low-cost breast cancer screening services near you, as well as a schedule at when they will be at a place near you. For example, a scan van can stop at your church or outside your community center, and you can get the care you need right there. These mobile screenings have the potential to save lives, and my data showed that these scan vans are successful in reaching women who need it. When the pandemic hit, I realized how delicate this progress could be. I studied how barriers to breast cancer screening were worsened amidst COVID-19. We realized that as a whole, preventable diseases became more dangerous, not because they were more aggressive, but because care became out of reach. This important realization led me back to what I was studying when I was making friendship bracelets. I didn't even know I was studying at the time, but I was learning about compassion. And I realized that compassion needs to be accompanied by action in order to make sure that a person's zip code doesn't determine their health or their health opportunities. I also pivoted and I wanted to learn about how breast cancer screening varies around the world. I studied countries like China, Japan, and Germany, and I looked at their approaches to population breast cancer screening. I realized that medicine is shaped by its social context. Policy determines and represents what different countries and societies care about. For example, I found some countries focused on individual level risk, while others focused on broader population level initiatives, including some mobile vans. I also brought my studies back to the US, and I looked specifically at how women at high risk of breast cancer are receiving the screening that they need. We studied specialty primary care providers, and we realized that there were certain barriers, such as a lack of knowledge about high-risk breast cancer technology, as well as a lack of time that a doctor has with a patient in order to fully understand their risk. This realization led me to study more about how we can work with storytelling and communities to bridge the gap between technology and community needs. This really opened my eyes to the fact that medical innovation doesn't always mean new technology. Innovation can also mean taking the resources that we have and making them more accessible, more community-based, and more available to the people who need it. I also brought my studies to a specific borough, which is the Bronx, and I looked at how diabetes affects the community. I learned that a complex complication of diabetes is diabetic foot ulcers. And diabetic foot ulcers, if leads to an amputation, has a mortality rate double that of all cancers. And people in the Bronx who have diabetes are at an increased rate of amputation. And globally, 50% of people who undergo amputation pass within 5 years. That striking statistic represents a life forever changed, a family member who loses a loved one, or a person who loses a limb. This data brought me back to what started this whole mission, which was compassion. I didn't realize it at the time, but as a student making friendship bracelets with my friends in elementary school, I was learning how small actions can lead to impact and how storytelling, people, and communities could lead to answering important questions and discovering important information that can shape the future of health and medicine. I discovered my purpose when I started making friendship bracelets, and it is so amazing to see how that has grown into research. Thank you.